Ang susunod na programa ay rated PG. Patnubay at gabay ng magulang ay kailangan sa mga batang manonood.
Opo, sige. Bali, differentiation ng infectious and non-infectious. Technically in medicine, when you say infectious, it means na the disease entity itself can be transferred from one person to another. Meaning, it's more on the side of communicability of the disease. Non-infectious, it's something that you acquire from genetics, meaning genetics from your family. Pwedeng sa mga kamag-anak, or pwede mo mapasa if you're the parents, di ba? If you're a parent or na may disease ka, pwedeng mapapasa mo siya. But not necessarily it can be get from one person to another. So, that's basically yung pinaka-basic differentiation ng infectious and non-infectious. For example, an infectious disease is TB, tuberculosis. Yun ang isa sa pinaka-common na sakit dito sa Pilipinas. So, we say it's infectious kasi once a person has that TB, has that disease, he can pass it to another person via airborne or droplet, usually sa saliva. So, sa air, pwede rin siya mag-suspend sa air. So, nakakahawa. Well, when you say non-infectious, it's like hypertension. You will not have that unless in your family, may history kayo. It's as simple as that.
Tuberculosis, or TB disease.
TB is spread through the air from one person to another. When a person breathes in TB bacteria, it can settle in the lungs and begin to grow. It is caused by Mycobacterium tuberculosis, which usually attacks the lungs. It can also attack any part of the body, including the kidneys, spine, and brain. It can be fatal if not treated properly.
Some people have serious side effects from TB medications. Should you develop any, you must call your doctor or nurse right away.
Transmitted by mosquitoes, dengue fever is a threat to almost half of the world's population. Dengue is a major public health problem, particularly in Latin America and Asia, where outbreaks occur regularly. When biting a person for its blood meal, an infected mosquito releases saliva containing the dengue virus. Once in the body, the virus infects the immune cells in the skin tissue. And enters the lymphatic system. The viral infection can then trigger a strong inflammatory reaction. During the incubation period, the virus first replicates locally. And then spreads into the bloodstream of the infected person. This is called viremia. For some patients, especially children, the infection may cause severe forms of the disease, including dengue hemorrhagic fever, the blood vessels become permeable, resulting in plasma leakage. Ultimately, dengue hemorrhagic fever requires intensive hospital care. When a mosquito bites a person who's already infected, it draws in the dengue virus contained in the blood. By biting another person, it can transmit the virus and spread the disease.
The heart pumps blood full of dissolved oxygen to the body through the arteries. Arteries are not simply tubes, but have elastic walls made of a special type of muscle. The muscle can constrict or dilate, making the arteries narrower or wider.
Damage to the inner wall of the artery causes fatty substances in the bloodstream to stick to it, forming plaques that make it stiffer and narrower in the process called atherosclerosis.
The kidneys play a part in controlling blood pressure by removing water from the bloodstream and excreting it in urine. They control the body's total volume of blood and thus the blood pressure.
Renin-angiotensin-aldosterone system, or RAS, or RAAS, plays an important role in maintaining a normal blood pressure. It controls the blood volume, blood pressure within the blood vessels, and functioning of the heart. Renin is an enzyme primarily released by the juxtaglomerular cells of the kidneys and also found in other tissues of the body. These enzymes are activated by the prostaglandins released by macula densa. Closely packed cells found in kidney macula densa are sensitive to change in levels of sodium chloride, NaCl, in the fluid that passed through them. Renin is released in response to sympathetic stimulation, fall in blood pressure within the renal arteries, and depletion of sodium levels in the distal tubules. The released renin acts on angiotensinogen, a glycoprotein synthesized by the liver. Renin cleaves the angiotensinogen to form angiotensin 1. Angiotensin 1 is converted to angiotensin 2 by angiotensin-converting enzyme, or ACE, found in the capillaries of the lungs. ACE also inactivates bradykinin and other vasoactive peptides. Other than ACE, enzymes like cathepsin G, elastase, tissue plasminogen activator, chymostatin sensitive AT2 generating enzyme, and chymase can also convert angiotensin 1 to angiotensin 2.
Discover more at Focus App Store, the simple way to explore science and medicine.
Asthma is a chronic long-term condition that can be managed but not cured. Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, For some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract. The airways narrow, and breathing through them produces a whistling sound, called wheezing. Mucus is produced from the lining of the airways, which clogs up the narrowed airways further and causes coughing. This makes normal breathing more difficult, producing symptoms of asthma that can be mild, moderate, or severe and life-threatening, where hospital treatment is needed. The narrowing of the airways is reversible if the trigger is removed, or if the inflammation is treated medically. Therefore, preventative treatment is used and can be managed by the patient themselves. An acute asthma attack requires medical intervention, but the type of intervention depends on the severity of the attack.
For more information, visit www.nhs.uk.